Are we doing enough to help disabled people move or travel? 597-4500, 514-597-4500, 1-877-597-4500 if you're calling from outside the Montreal area. Laurence Parent is our guest today. And now let's go to the plateau where Amy is on the line. Hi, Amy.
Hi.
So what do you think about this situation?
I completely agree with Laurence that this is a social justice issue for all the people that live in Montreal. I'm a pediatric nurse that works at the Children's Hospital, the Montreal Children's Hospital at Atwater Station, and I think that it's really unfortunate, or even I'd have to say ridiculous, that that station isn't accessible, because we have lots of patients and families who come. The children have accessibility issues, or even for patients that don't have accessibility issues but are younger and their parents bring them in strollers. They're always surprised when we tell them, that station isn't really accessible if you're coming on public transit. It's going to be a lot of work for you to get your child to our hospital.
And how often does it happen that they get there and that they aren't able to move because they weren't aware of the situation?
Well, I can't really give you numbers, but I mean, I've heard from parents say, "Oh my goodness, I had so much trouble coming here in the metro, or even on the buses." I find here, I've lived in a couple other big Canadian cities, and I find that it's very difficult to ask the bus driver to kneel the bus. They're often not willing. People often don't obey the signs in the bus that say there's a place for wheelchairs or for strollers. You need to put up the seat. These people have priority. So the parents often come tired and a little bit frustrated because they've had trouble coming on public transit. And I think a lot of people in Montreal rely solely on public transit, like your guest. And it is completely a justice issue.
It is a social justice issue.
Who don't have a choice, but need to get around the city for their work or for their health or things like that.
Amy, thank you very much for calling.
Thanks so much for having this guest on. It's great.
Okay. Bye-bye. That was Amy on the plateau. What are your thoughts? 597-4500, 514-597-4500 in the Montreal area, 1-877-597-4500 if you live outside the Montreal area. Now, Hans, we were talking about the situation here in Montreal, but what about in rural areas? Or, you lived in Quebec City for a while, I think, huh?
No, just for 8 months.
8 months. Well, what was it like getting around there?
Oh, no, I was like, I'm born in Quebec City, so I don't know.
Oh, okay, so you left when you were 8 years old.
Yeah. No, in where I'm from, there's no public transit system, so it's difficult to compare. But I know that Montreal is the only city in Quebec which have wheelchair-accessible buses. This is what I heard. They have low-floor buses in Laval, in Longueuil, in Quebec City, but they don't have a ramp. Maybe I'm wrong.
So what's the point, right? And I'm sorry. So you have the ramp, the buses. If there's no ramp, there's no way to get on the bus.
Exactly. So here it's getting better, but I think that right now the biggest obstacle are the attitudes. It happens frequently that drivers are not willing to let me in. Once it happened that the driver just told me, "Oh, are you sure that you want to get on the bus?" I was like, "Yes, sure, I'm sure. I want to get on as anyone else." And the bus was wheelchair accessible. So I think that there's a lot of education to do.
And what did he do when you said, "Yes, I do want to get on"?
Well, he finally tried a ramp, but he was grumpy and not really happy about having me on his bus. So and it's not just one situation, it happens over and over again.
We had another text coming in saying it might be convenient to replace the stairs for ramps. Would that, how much of an impact I don't know how you would go down the stairs or down a ramp.
No, it will be too steep. They really need to build elevators in the stations.
514-597-4500, 514-597-4500, 1-877-597-4500 if you're calling outside of the Montreal area. And right now we're going to go to Huntsic, where Mahar is standing by. Hi, Mahar.
Hi. I actually wanted to comment on this because, while I totally agree that it's a social justice issue, but as well there is another issue of that actually was mentioned by the nurse as well. It's parents with kids. We have twin boys, and my wife works downtown. They go to daycare downtown, and we realize that the handicapped people really don't have access because with a twin. With a poussette, like with a carriage, there was no way we could get in the metro. So we actually had to drive downtown every day to be able to get downtown. And then here you see that it's not just an issue of handicapped people, it's actually an issue of access to transportation for everybody. If you really want to encourage public transit, as they say, they should make it accessible. And then, as I was saying, then we realized that, we have kids and we can't get them there. Definitely a handicapped person. There's no way a handicapped person can get in that metro. And I think it's a shame. A society like ours should it wasn't taken care of in 1966. We should take care of it now.
Thank you very much, Mahar.
Thank you.
Thank you for sharing that. Well, joining us now is Lisa Westaway. She's a vision rehab specialist at the MAB Mackay. It's a rehab center for people who have vision or hearing impairments, and she's on the line now. Lisa, hi.
Hi.
So what kind of things do people with visual impairments face on a daily basis when they head out to work or to school?
Well, if we look more specifically at the metro, like you were discussing, there are many issues with regards to accessibility for visual impairments as well, with regards to contrast, for example, and lighting. So the lighting is really very dim, and the signage that you would have is really low contrast. So, high contrast would mean white writing on a black background. It makes with larger writing, so it makes it more visible. Mm-hmm. So people with visual impairments aren't really taken into account with those things. Also, construction within the metro system is not well identified, so really difficult. So somebody who would normally takes a specific route day after day, if there are any changes to that route, modifications, then they're unable to, they're not aware of it. So there's a lot of safety issues as well. There are irregular staircases, especially in a lot of the older metro systems. Somebody who's used to counting stairs or just knowing the distance from one step to the other. If the staircase is irregular, it's hard to be able to, there's a safety issue with regards to stairs, so a lot of falling. Some metro stations, there's actually an accessibility team that was put together with the two rehab centers in the province and the STCUM, and they looked at accessibility. And so they started modifying some of the metro stations, which is interesting, either by identifying the first and last step with high contrasting fluorescent markings, or by contrasting but also textured tiles that identify where the tracks are going to be, so that somebody who has no vision, somebody who doesn't have any functional vision, who's using a cane, could identify by the texture, they know to stop so that they don't walk into the tracks, basically. So there are some things that are starting to change, which is nice. Laurence mentioned a lot about attitudes, and that's one of the big issues. Going onto the bus and actually asking the bus driver to tell you when you get to a stop so that you can get off the bus. Those are always difficult things, and
you encounter the same kind of resistance.
Yes. Yeah, exactly. And I think part of it is just not understanding impairments, especially with regards to visual impairments. Really, when you say that someone's blind, you think that they have no vision at all, but 80% of the population has functional vision. So how you adapt the environment makes a huge difference to their independence in society. And it actually, environmental factors actually influence whether they have a disability or don't, because sometimes the environment is what creates the disability.
Lisa, thank you very much for helping us understand a little better.
No problem. Okay. Thanks for having me on.
Lisa Westaway, she's a vision rehab specialist at the MAB Mackay, and 514-597-4500, 514-597-4500, 1-877-597-4500. So, Laurence, in the film, you contrast the declaration that was made on Saint-Jean last year about we've matured, we've evolved, we've come up with a revolution, and for you, it just doesn't work that way. You feel excluded.
Yeah, I think that the quiet revolution was too quiet for people like me.
Yeah.
Mm-hmm.
How long do you think it will take before the awareness, like we heard Marvin Rotran basically saying, look, it's not a first priority, it's just too costly?
Mm-hmm. Well, during the last electoral campaign, Gérald Tremblay promised that the STM will make one subway station accessible per year. So if this promise...
If he keeps his promise.
So the Montreal Metro will be accessible in 2071. So in 60 years.
In 2071.
84 years old.
2071, one a year.
Mm-hmm. But I hope that more people are aware of the situation. It will happen sooner.
Wow. Mm-hmm. Hopefully they will.
Yeah.
Thank you very much for coming in. Congratulations.
Thank you so much.
And when do you head out to California?
On Thursday morning.
On Thursday morning. Yay! Good luck. Thank you. Laurence Parent, and the name of the film Je me souviens, excluded from the Montreal subway since 1966. And Laurence, winner of Emerging Artist Award, Superfest 2010, the International Disability Film Festival. That's our program for today. Thanks for listening. I'm Bernard Senara. We'll talk to you tomorrow.